What is Cleoson vaginal cream? Cleoson, clindamycin phosphate vaginal cream is an antibiotic used in the treatment of bacterial vaginosis, formerly referred to as Haemophilus vaginitis, Gardnerella vaginitis, nonspecific vaginitis, Corynebacterium vaginitis, or anaerobic vaginosis. What are side effects of Cleoson vaginal cream? Common side effects of Cleoson vaginal cream include yeast infection, vaginal infection, itching, irritation, vaginal pain, discomfort or pain when urinating, inflammation, white patches in the mouth, thick white vaginal discharge, burning and swelling of the vagina, constipation, nausea, headache, and back pain. For intravaginal use only. Not for ophthalmic, dermal, or oral use. Description: CLEOCIN vaginal cream 2% is a semi-solid white cream, which contains 2% clindamycin phosphate, USP, at a concentration equivalent to 20 mg clindamycin per gram. The pH of the cream is between 3.0 and 6.0. The cream also contains benzyl alcohol, cetosterol alcohol, mixed fatty acid esters, mineral oil, polysorbate 60, propylene glycol, purified water, sorbitan monostearate, and stearic acid. Each applicateful of 5 grams of vaginal cream contains approximately 100 mg of clindamycin phosphate. Indications: CLEOCIN vaginal cream 2% is indicated in the treatment of bacterial vaginosis. CLEOCIN vaginal cream 2% can be used to treat non-pregnant women and pregnant women during the second and third trimester. Note: for purposes of this indication, a clinical diagnosis of bacterial vaginosis is usually defined by the presence of a homogeneous vaginal discharge that A has a pH of greater than 4.5, B emits a fishy amine odor when mixed with a 10% co-solution, and C contains clue cells on microscopic examination. Graham's stain results consistent with a diagnosis of bacterial vaginosis include a markedly reduced or absent lactobacillus morphology, b predominance of Gardnerella morphotype, and c absent or few white blood cells.